Welcome to our project, Decipher Your Health, where we make videos and write blog posts about various health issues that we think are really important for people to know. My name is Marijke, and I am a registered nurse. I've been a nurse since the 80s, so I've had a lot of experience. And my partner is Karin, and she is an emergency room physician. Today, which brings me to my next point. Today, we are recording this on National Women Physicians Day. So I'm sure Karin will have something to say about that. So today we're going to talk about how to prepare for a visit to the ER, the emergency department, and what you should bring with you. So Karin, I'll leave it to you.
So different things to bring up. We might have mentioned this in a previous video, is once again bringing your ID and insurance card, a patient advocate. We'll elaborate on that further. Hearing aids or glasses if you need those, because we sure as heck want you to be able to hear us and see us, and a pen and paper, your phone, and a charger, just to make sure that you have all that stuff with you. And one of the most important things is, even though you're in an emergency and you may be in panic mode, feeling like you need to be seen immediately, the triage nurse may not prioritize you to be brought immediately back to a room. So rather than having your blood pressure and heart rate go through the roof, this is a good opportunity to make sure you optimize that window with the treatment team. I want you to be able to explain quickly and concisely what is the concern bringing you to the emergency department. If you're having abdominal pain, for example, when did it start? What have you tried to make it better? What have you tried to, any medications that you might have tried for this? What seems to make the pain worse? Are you having any other symptoms with that? A fever, for example, vomiting, diarrhea. So we want to know when this illness started, when you last felt like your normal self, and how things have progressed. It's also important for us to know.
Can I interrupt for a minute, Karin?
Sure.
You mentioned the triage nurse. Now, the triage nurse's job is to assess who needs to be seen before somebody else. So let's say he or she determines that you can wait a little bit. What if you get worse while you're waiting? Should you approach the triage nurse again?
Either that, or if you're really smart and you brought a patient advocate with you, you can have them go speak to the triage nurse and say, look, I am concerned that my family member, my friend, my associate is getting worse. They are now XYZ. Now, if it's just that you're worked off that you've been having to wait for an additional 20 minutes and you've seen other people go in and there hasn't been a change in condition, that can be quite challenging for a triage nurse. And let's put it this way, kind words make kind things happen. So if you can show some generosity and kindness to your treatment team, who truly are trying to do their best, it will be shared with you ad infinitum. One of my common sayings is nice words make nice things happen. Unfortunately, tempers can rise in the emergency department. So I've been called a litany of profanities before. And as long as you put a doctor before, no, I'm just kidding. It's just best not to engage in negative behavior. I totally get it if someone's really in dire straits, but it is frustrating to have someone call you every name in the book when you're truly, really trying to do your best by a patient. And in honor of National Women's Physician Day, I do have a plea. When a woman physician comes into the room to evaluate you, and she has a very limited amount of time to see you, please don't make her leave the room to fetch you a warm blanket, ice chips, juice, whatever the case may be, because that is valuable time that you are losing with your provider. The minute that she leaves that room, she could be prompted to go see another emergency in bed 8. And you will wonder where she has gone for the last 30 minutes. And if you're in a negative thought loop, you're going to, and that will just cause tensions to rise even further when she returns to the room. So please, it's okay to let someone know if you need a bedpan but I want to make sure that you are ready and prepared with your story when that physician comes in the room. Okay, so let's help you optimize that story. Again, when did you get sick? What makes it better? What makes it worse? Any medications you've tried, your past medical history. If you're a diabetic, my concern level is going to change on certain things.
Mhm.
If you have high blood pressure, my concern level is going to change on certain things. What medications you're taking on a regular basis, what your allergies are. And if you tell me, for example, that there's a strong family history of Crohn's disease and you're coming in with abdominal pain, that will change my differential. That's important information for me to know. And the minute that you tell me, just go look in the computer, that again takes me away from you. Valuable time that I can figure out what is going on, okay? The other thing is, you might be wondering, why am I waiting in the emergency department for 3 hours, okay? That could be time that we're using to see, are you getting better with the medicines that we've given? Are you getting worse? Are your vital signs changing? Is there a consultant that I'm waiting to hear back from before I decide what the next steps are? Okay. So an ER physician, we're thinking in, out, don't know. Are you going to be admitted to the hospital? Are you definitely going home? Or do I not have enough data yet? So please be patient with us as we go through this decision-making process. And please bring a patient advocate. Because, for example, if I give you a dose of pain medicine because you're in horrible amounts of pain, you may not be able to understand additional information that I'm giving. For example, if you've got a horrible kidney stone and I'm trying to go through a detailed explanation of what the next steps are. I don't know, the only time that I got morphine, Marijke, when I had my appendix, I guess I asked the nurses if my face was melting. So I think it's really important that you make sure you have someone there with you to get that additional data.
But what do you say if, like, I'm thinking back when my daughter turned 18, just a couple of weeks after she turned 18, which is the legal age here, for everything. And she had a severe abdominal pain. So I brought her to the closest adult hospital. Before that, we had only dealt with the children's hospital, where I was with her every time she had a problem. But I brought her to this, and it was a very good hospital. I really like it. But they wouldn't let me stay with her. And she was in agony. And like in her mind, I mean, she was 18. She's technically an adult, but she wasn't acting like one because she was in so much pain.
So you're bringing up a really good important point, because one of the challenges during the pandemic is we lost that patient advocate at the bedside, due to all the PPE restrictions, the visitation restrictions. And I'd have to say that that was a nail in the coffin for my joy with being able to practice medicine, because I feel like one of the challenges is that we lost that person at the bedside who could provide so much important additional information. And I think it's important for the healthcare system to ask the patient themselves, can your mother be with you during this emergency department visit? And also as a patient, knowing that you have the right for not having mom hear everything, okay?
Mm-hmm.
But clarity is important, and if you're being dishonest with your care providers or with your healthcare advocate who's at your bedside, it can affect your care.
Mm-hmm.
So it's important to have someone who, you would feel comfortable sharing your most intimate secrets with, or making sure that you clarify when the person is in the room. This is my coworker from the office who dropped me off. They're just here to provide some comfort. I would like them not to hear about X, Y, or Z thing. Can they step out of the room?
Mm-hmm.
Okay.
Okay. Well, I hope that was helpful information. The more you know about going into the ER or urgent care clinic, the better it'll be to make the process, the easier it will be. Sorry about that. So I just wanted to remind everybody that this, a little bit of a disclaimer, we have it written in the about section of the YouTube channel, but we just wanted to make sure that you understand that we are not offering diagnosis or treatment. And Karin always says it really well.
Well, I guess the way that I want to say it is we would love to educate you, but we do not have a one-on-one relationship with you. That you are free to share this information with your healthcare provider with whom you have that relationship. Do not stop medications, start medications based on the information that we are giving. Make sure that you consult your healthcare provider.
And that's it for now. So we will see you with their next video. Bye.